Are you ready to develop valuable skills you can put to work? Join the Virgin Islands Department of Labor's Work, Learn, and Earn program. It is a 12 weeks paid work experience for out-of-school youth ages 17 to 24 with little to no work experience. This program provides you with the opportunity to develop your professional skills in a professional work environment in your area of interest, with the goal of connecting you to full-time employment. For more information, call us at 340-773-1994 on St. Croix or 340-776-3700 on St. Thomas, or email kevin.dixon@dol.vi.gov. The Youth and Apprenticeship Division is committed to building skills and making opportunities.
Has the COVID pandemic caused you to fall behind on your rent? What about your electric or water bills? Well, VIHFA's Emergency Rental Assistance Program is here to help you catch up. For program details and qualifications, go to VIHFA and click on the ERAP link. From there, it's just 3 steps. 1. Make sure you are eligible. Have you lost income due to COVID-19, owe at least 1 month of rent or utilities, and meet the federal household income guidelines for your island? 2. Gather all the required ID and documentation for all members of your household, plus statements from your landlord or utility company. 3. Submit your application online at vihfa.gov or call one of the intake centers on your island to make an appointment to apply in person. For more details and locations of the intake centers, please visit vihfa.gov.
Good day, Virgin Islanders, and home and abroad, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of February 28, 2022. Joining me this afternoon is our very own epidemiologist, Dr. Ellis, for the latest on our COVID statistics and information on where Virgin Islanders can get a free COVID-19 test and a vaccine this week. Without further ado, Dr. Ellis.
And thank you, Governor Bryan and Commissioner Encarnacion, for the opportunity to provide COVID updates today. The Department of Health thanks everyone who continues to abide by both Governor Bryan's and the Department of Health's guidance on how to reduce COVID-19 transmission. DOH is extremely grateful for the cooperation and support given by other agencies, private entities, and you, the community. Thank you. As of February 28, 2022, a total of 334,219 tests have been conducted in the territory. Of those tests, 15,398 individuals have tested positive. The 7-day positivity rate is 3%. I would like to congratulate all Virgin Islanders who decided to protect themselves, their loved ones, and the community by getting vaccinated. Presently, we have provided 67,419 first doses of the vaccine and 55,896 second doses. We currently have 95 active cases in the territory, 64 active cases on St. Croix, 26 on St. Thomas, and 3 on St. John. 15,194 cases have recovered, and we have suffered 109 fatalities. Prayers and support go out to those who have lost loved ones. As of today, the 28th, the Governor Juana Fleury Hospital Medical Center reported 2 COVID admissions, with 1 vented. The Schneider Regional Medical Center reported 1 COVID-19 admission, with 0 vented. As a reminder, the Department of Health testing on St. Croix and St. Thomas is for anyone with COVID symptoms, cold, cough, sore throat, headache, or anyone who is suspected of being exposed. The scheduled hours are 9 a.m. to 12:30 p.m. by appointment. Please pre-register using this link, www.covid19.usvi.care/testing. Testing on St. John is available on Wednesdays from noon to 3 p.m. at the VI Port Authority gravel lot. In collaboration with the Virgin Islands Department of Health, Education and Department of Education, pop-up testing is available for VIDE staff and students the last Friday of every month, 3 to 5 p.m. at Complex on St. Croix and Old Cinema 1 parking lot on St. Thomas. The hotline hours will change from 8 a.m. to 5 p.m. Monday through Friday, starting on Wednesday, March 2nd of this week. The EPI hotline numbers are accessible for callers to report suspected cases at 340-712-6299 or 340-776-1519. The schedules for the community vaccine centers remain the same and can also be accessed on the DOH website at www.covid19usvi.com. Children visiting either the CVC or the MCH clinic need to be accompanied by a parent or guardian. Also, don't forget to bring an ID for you and the child, as well as the child's birth certificate. The VI Youth $250 gift card giveaway is still going strong. The program began January 31st and will run through Friday, March 18th. Children residing in the USVI between the ages of 5 and 17 who received their second dose of Pfizer prior to March 18th will receive a $250 gift card at this time of the second dose administration. I'm pleased to say, again, there's no need to wait. Children who became fully vaccinated last year when the vaccine was first approved for the younger age group prior to January 30th will also receive a $250 gift card. And gift card distribution began February 16th at the CVC on St. Thomas and St. Croix, and also at the Morris de Castro on St. John, between the hours of 9 and 4 p.m. Lastly, I'd like to speak about the upcoming HIV Summit. The Division of Communicable Diseases will be hosting the first, quote, 340-0, end quote, HIV Summit on Thursday, March 10th and Friday, March 11th at the University of the Virgin Islands St. Croix campus. This is the first summit to be held in the Virgin Islands and will bring together primary care providers, allied healthcare professionals, primary care health teams, community organizations, community health workers, and people who have lived and experienced through experience from the Caribbean. The Department of Health is very proud of the work that has been done to bring the summit together and to end the HIV epidemic in the USVI by 2030. You can still register for the summit at bit.ly/HIV Summit. If you have any questions, email robert.thompson@doh.vi.gov or pcdc@hip@pcdc.org. This will be a fully vaccinated event and masks are required. In closing, let me remind everyone that you can keep up with the latest information, including COVID-19 epidemiology and vaccine data, by visiting the U.S. Virgin Islands Department of Health Facebook page or website at www.covid19usvi.com. And for COVID-19 health information alerts, text COVID-19 USVI to 888-777. Thank you for the time to share this information with the public. I'm happy to take any questions. Back to you, Governor.
Thank you, Dr. Ellis, and I just want to say that I've been looking every single day to see it drop below 100 active cases, and we have 95, so that's always in the right direction. I'm very grateful to see that. I want to take a moment this afternoon, though, to say thank you. Thank you to all of you who have hung in there and did what was required to protect our community over the last 2 years. We've had a lot of ups and downs during the time, and we've learned some lessons along the way. We've taken steps forward in our faith in our path to the new normal, and even took steps backward when it was necessary. Today, we are about to take one giant step forward. In no uncertain terms, this pandemic is not over. COVID-19 is still a threat, especially to our elderly, our immunocompromised, and those people who are just vulnerable to the disease genetically. However, we now have the information and resources to mitigate the severity of this virus and its threat to our public health. And with that, I'm announcing today changes to our existing COVID-19 protocols. Our new COVID protocols effective today, February 28, 2022. In regards to events, events no longer need COVID DOH approval. However, DOH, Department of Health authorization, is required for events that gather more than 999 people. Any non-COVID permits required by any regulatory agency with jurisdiction over an event are still required after health approval. So you still need police and everybody else to get those permits done, but health has jurisdiction over 1,000 people. For restaurants and nightclubs, bars, including restaurants, bars, and nightclubs, including bars with a nightclub or cabaret license, food trucks, houses of worship, indoor recreational facilities, gaming centers, and retail and wholesale stores may operate according to their respective business licenses and permits. However, they must still observe masking rules and social distancing while indoors. If you are not required to wear your mask or facial covering when seated, you are not required to wear your mask or your facial covering when you're seated in a restaurant or any bar. You are not required to wear a mask or facial covering when outdoor in the outdoor section of an establishment. To be clear, the outdoor section of an establishment in this instance is any section of a structure or establishment not covered by a roof or a section covered by a roof but enclosed by less than 3 walls. So for those people who have been asking for it for a long time, that's no longer required at your beach bars and those types of places. You don't have to wear a mask anymore. Outdoor food trucks, they don't have to wear a mask if you're a patron going to that. You are not required to wear a mask or facial covering in the kitchen of a restaurant if you're fully vaccinated. You are not required to wear a mask or facial covering at a Department of Health authorized all vaccinated event. As for gym and wellness facilities, wellness centers, fitness centers, gyms, tennis courts, athletic fields, and golf courses may operate according to their respective business licenses and permits. Barbershops and hair and nail salons and massage therapists may operate according to their business licenses and permits. Nursing home visitation. Visitation to nursing homes is now allowed with a negative COVID test taken within 72 hours of proof of vaccination. If you were trying to visit before, we had a complete ban on that visitation, so now with the 72-hour test, you can go in. There's no longer a moratorium on evictions except for individuals under the Emergency Rental Assistance Program. So if you have an application into ERAP, your landlord can evict you. But however, if that application is resolved or they're evicting you for a reason other than your rent, or they can evict you. So the very fact that you have an application in to pay your rent is not enough. You also have to comply with all the other things in the lease. So if they're evicting you because you have a dog, you're not protected. There's no longer a freeze on the increase of any rent in the territory, so landlords are free to wage the rent however they feel effective. Effective March 1st, we are suspending all COVID-related telework agreements for the government. I'm going to say that again. Effective March 1st, we're suspending all COVID telework agreements for the government. All government employees are to return to work in person during normal business hours tomorrow, March 1st, 8 a.m. sharp, or if you have another reporting time, you need to come to work at that time. When we say COVID-related, people have telework agreements for other things, whether they work remotely or they may have some issue with the building that they're working in or whatever. Those are fine, but everybody else, back to work. The changes to our protocol announced today make way for our students to transition to full in-person learning on Monday, March 14, 2022. Listen out for your Department of Education and your specific schools, how they will be transitioning those students in, so everybody is going back to school. As I mentioned, we have come a long way in the last 2 years, and today, because of our collective efforts, we are here now taking this step forward to normal. I know that moving forward will be okay, largely because you, all of you out there, and the vast majority of you at least, are doing the responsible thing. One of the things that I absolutely want to share is how proud I've been to have led you through the darkest hours in this pandemic with the team, and I thank them. Last week we had our official last COVID calm meeting, hopefully, knock on wood, from when we used to do it almost every day to twice a week to now we're just getting updates from the Department of Health and other departments. It's been almost exactly 2 years since we started, probably a little bit more than 2 years, and it has been a rough 2 years, and I know a lot of people will be suffering from the fallout of COVID for years to come, whether physically, mentally, and certainly financially. So we're doing our best to try to strengthen the community with the tools that they need in order to get better. I take particularly real concern with this because we've been allotted a lot of assistance in order to help people. So as the months come on, you will see us doing things, including the premium pay everybody keeps talking about, to continue to bolster and strengthen our community, because just because the virus isn't in rampage doesn't mean that we don't still have damage inflicted on our individuals. And some people have done really well through the COVID, but others have not fared as well. And those people are the ones that we really want to make sure are okay. So we're taking a big step today. We're not sure if we'd have to withdraw a lot of these restrictions back again, that we'll have to put them back in place. But we feel confident at this point with the amount of people that have had vaccines, the amount of people that have had COVID, that we can find a way forward and really try to start to get back to normal. In other news, I also want to publicly, I haven't been on the press conference for a couple of weeks, so I just want to say to the whole entire Otley family, Brown family, and all the other related families, friends, relatives, and Virgin Islanders of my cousin Addie Otley, my condolences. This is essentially Addie Otley week in the Virgin Islands. The VI flags are ordered to fly at half staff from today till Friday. He was an extraordinary human being, contributing here in the Virgin Islands as a senator, a lieutenant governor, and a long time just as an average citizen on the radios, helping being that voice from the storm. So tomorrow we will have a service at University of Virgin Islands, Keene campus on St. Thomas at the gymnasium there. He will lie in state on Wednesday at the legislature. His body will then be moved to Government House, because he was a senator and a lieutenant governor, where he would lie in state, and then he would be buried or interred at the cemetery on that afternoon. Then on Thursday, we will be renaming the section of a street from where Pueblo is, across from the BMV in St. Thomas, right down to the Ariadne Drive. So you can stop by and visit that. We have a lot of family in town, I hope, who's listening. Welcome home. It is for a sad occasion, but tomorrow we celebrate, well, all this week, we celebrate a Virgin Islands hero. Speaking about Virgin Islands hero, this is the beginning of VI History Month, and it's a time for us to reflect and remember. March 1st is a time when we commemorate all the people that have been able to do the things that to get us here. And don't forget the ones that are still alive and making history. I often think about my my commissioner, actually my cabinet member, Positive Nelson, the first Rastafarian elected to public office here, I think in the territory and on the mainland. He's also the former of a labor union, a commissioner, and a senator. Living Black history, living Virgin Islands history right here. So, remember the ones that have passed us, but the ones that are still here, because history is every day. It's a time for us to reflect on who we are as a people and from whence we come. I'm going to pause now for any questions from the press. I see the Daily News is on there. Any questions? Susan Ellis. Ernest Gilbert.
Gov, can you hear me?
I can hear you.
Yes, good afternoon. I have a few questions, Governor. Obviously, today's a big day, as you mentioned. Let's talk about the restrictions easing you announced here. You mentioned within clubs and similar facilities that folks need to continue wearing masks when they're standing or dancing, and they must social distance. That's what you said?
That's right. We're not, we know we've been getting a lot of calls and a lot of people have been stopping me about lifting the mask mandates. We're not just so sure just yet about that, so we're going to ride it out for another week or two and see what happens once we lift these restrictions, and then we'll lift the mask mandate if we see there's no bump in our numbers.
So, Gov, the CDC, as you know, on Friday eased restrictions for masking indoors and even in schools for jurisdictions with 100,000 people or less whose 7-day positivity rate is below 10%. That is considered low. Ours, as you announced today, is 3%. Why are we not following the CDC's guidelines today?
Oh, one because the CDC has been wrong before. Right before Delta, they pulled back all of the restrictions, and a lot of states did too, and they paid the price heavily. Number two, because we have a lot of people in our community that are immunocompromised, and we don't have the resources of a lot of the places that they're talking about, whether it be hospital beds or otherwise. And thirdly, because there are a lot of people in our community who are literally terrified about COVID. And I think that catching COVID and getting sick, or the people getting sick, and I think that the way we transition into all these restrictions, we have to transition them out, respecting those people's feelings and giving them a little bit of security till we're in a state where we feel like we can manage it.
All right. And so a quick follow-up to that is, you said you're going to watch this for the next week or two. Can you give me if it's a week or two, please?
More like 2 or 3.
All right.
Look, so we took away essentially we took all of the mass gathering restrictions away. Now you can come in the portal with any, starting next week, you can come in with any vaccination you can get to come to the Virgin Islands. We took away the restriction on casinos and taxis on ferries. The only restriction on ferries is people coming from the BVI, because there are some federal mandates that remain in place, irrespective of what we do in the Virgin Islands. But we just feel like we got a little bit way before we just go hog wild on this.
All right, so that's a big piece of news there. So beginning when did you say about the portal? Any vaccination status?
By
Beginning when?
next week Monday, any vaccination will do. We just need to give the airlines enough time so we don't have confusion. So we start that process today. By next week, you just need a vaccination card to get into the Virgin Islands.
All right, Governor, I'm gonna go quickly. You said about the Department of Health. You're still gonna need to wear mask unless unless it is an event put on by the Department of Health, either vaccinated or otherwise.
Put on or
So
sanctioned. Yeah, I mean, you could go there and they could give you the authorization, you use the right protocols where you don't need a mask. But if you're going to have mixed events with people who are vaccinated, unvaccinated, and whatnot, we want you to wear the mask.
I think what you said, Gov, is that for the DOH events, vaccinated or otherwise, you might not you don't need to wear a mask.
Right. That's what I just said.
So why not for other facilities, and why only for the Department of Health?
Well, it's not only the DOH, because they don't throw functions, they just sanction them. So if you clear it with them, the protocols that you're using for your event, then you're fine.
Yeah.
That's all we're saying.
Okay, understood. All right. Quickly here, Gov, can you give me a quick update on the situation with our attempts in the bond market? Have we gone in? What's happening there?
Last week is a process to this. Like I said, we still had a lot of work to do. Last week we settled 30-year lawsuits that we had with the GRS. I think it was monumental that we got that done. Those things are resolved now, where we owe the GRS upwards of $50–60 million. All of that is resolved. The next step, we have some work to do with Treasury, setting up the SPV. We've had our first special purpose vehicle board meeting last week where we authorized the bond issuance. Treasury needs to give us some approvals and we need to get some other stuff, but we're doing a lot of different things at one time. So we're expecting to go to the market. We're expecting to close by the end of this month, March 31st. So we're going to the market this month.
Okay, and some quick ones here. Camping. Folks are asking me about camping. Are folks allowed to camp come this season?
Absolutely, people are free to go camping as it will. Just be careful. I mean, like I said, let's not go hog wild. It's outdoors, so there's no mask requirements at this point. But just be careful.
And premium pay, Governor, I think you said payments would be coming out at the end of this month. Where are we? What is the status on the issuance of payments related to premium pay?
Nah, I didn't say this month. We're scheduling premium pay for the summer. This month is March. I think we're going to try to get out some more tax returns. We'll let you know if we're going to get that done. Cash is running slim. Numbers are still kind of sketchy going in. We had that. We didn't really expect to have Omicron have the impact on travel as it did in January. So cash is looking a little bit slim coming out. So we're just watching to see what's going to happen.
May you elaborate, Governor, on cash? You're talking about our liquidity?
Yeah, we have liquidity, but I'm saying when you look at our revenues for the year, some of our stuff is down significantly. Corporate income tax is up, gross receipts and income tax is down a little bit. So we're just looking to make sure that we can hit the numbers we can, because we got a teacher's contract that we're getting up. We're about to go to steel workers, principals, plus we're doing the payment to the retirement system of over $40 million in cash that we did not anticipate. I also said I'm going to give the $25 million, at least $25 million back on the retro payment this year. So we're just watching our cash to make sure that we can manage all and issue it so we don't put ourselves in a cash trap situation.
Thanks, Governor. Finally, you said March 14th, all schools will be back, public schools will be back. I thought public schools were back in session. In person. Do we still have schools that are virtual?
They're not every day, all day. So they have some days in, some days out. It's staggered schedules. So everybody at school one time. That's what we're talking about. And different schools will have different transition period because every facility is different. So we're working with Department of Education, but I think with all that we're doing now, we're looking to start putting people back in school every single day.
Awesome. Gov, thank you.
Thank you so much, Ernest. I think that exhausts our people for questions this afternoon. I guess it's going to be, eventually we're going to stop doing the COVID-19 update. You won't get the opportunity to see me every week or every other week, which is a good thing in one way, bad in the next as we press on. Like I said, we're making our arrangements for Carnival, Watarugudu in 2022. It's going to be a limited edition Carnival, but still the same. We got that going, and I just want to say again, thank you to all the people out there who have made us able to survive this far. We're not over yet, but I'm feeling like we're seeing the light at the end of the tunnel and we're coming through. So you just, be careful out there. Do what makes sense. Remember, you could wear your mask even though you don't need to. You're outside, you can still wear your mask and protect yourself. You can still have an opportunity to get vaccinated and boosted, and just keep the faith as we move on. Have a fantastic day. Love you. Have a